Hi, in this video I will be performing the CNA testable skill perform Peri-Care or Perineal care on a female. This skill is performed on a mannequin. However, you still need to communicate and treat the mannequin as if it were a live resident. So, without further ado, let's go ahead and get started. So let's go ahead and talk about the supplies that we will need. You will need 1 or 2 towels. 1 towel is to dry. The second towel you can use to place as a clean barrier on your table. However, that second towel is not mandatory. Okay? You will need 4 washcloths. 1 to wash the genital area, washcloth 2 to rinse the genital area, washcloth 3 to wash the buttocks, and washcloth 4 to rinse the buttocks. Okay, so that's 4 washcloths. You will need soap, a linen protector, 1 pair of gloves, and a basin. So why don't you go ahead and gather your supplies now. While you're gathering your supplies, I would like to inform you that this skill does have 3 critical element steps. Steps number 8, 9, and 11. You have to perform these steps and you have to perform them correctly in order to receive credit. If any of those 3 steps 8, 9, or 11 is completely omitted or not performed correctly, you will automatically fail that skill because they are critical element steps. So when I perform those steps, I want you to pay very close attention, okay? So hopefully we have all of our supplies together. Again, 1 or 2 towels, 4 washcloths, soap, a linen protector, 1 pair of gloves, and a basin. So why don't we go ahead and start the skill. Before entering into the resident's room, you will want to knock on the door and wait for a response. If you do not hear a response, knock again. At this time, you may enter the resident's room. Upon entering, you will want to introduce yourself by both name and title. Hi, Mrs. Jones. My name is Julie, and I will be your CNA today. After the introduction, you will want to explain the procedure to the resident. Mrs. Jones, the nurses asked me to come in and perform Peri-Care. Is that okay? All right. Now keep in mind, in a real-life situation, some residents may not understand what Peri-Care or perineal care is. So you will want to explain the procedure in terms that are easily understood by the resident. However, for testing purposes, I want you to explain the procedure as it is listed on your assignment card. Now that we've introduced ourselves, we've explained the procedure, you want to get in the good habit of verifying the resident's identification. Why? Well, we want to make sure that we're giving the right care to the right resident. Mrs. Jones, is it okay if I look at your ID bracelet? Okay. All right, thank you, Mrs. Jones. I just want to make sure I'm performing the right task on the right resident. Now we can go ahead and provide the resident with privacy by closing the door and privacy curtain. This is also a good time to do a quick safety check, making sure that the brakes on the bed wheels are locked, bed is in the lowest prescribed position, and the resident has his or her call light. Mrs. Jones, I'm going to go ahead and wash my hands, gather my supplies. But before I do that, I'm just going to provide you with privacy. I'm going to close your door and your privacy curtain. And I just want to do a quick safety check. Just making sure that the brakes on the bed wheels are locked, bed is in lowest prescribed position, and you have your call light right here. If you need me for anything before I return, just push this button, okay? All right, Mrs. Jones, I'll be back with my supplies. Hi, Mrs. Jones, I'm back. I have my supplies and I'm ready to get you all cleaned up, okay? Okay, so before you actually start cleaning the resident, you want to make sure that you test the water temperature. You can either test with your wrist or your elbow. After you test the water, you want to allow the resident to also test it. Even though we're performing this skill on a mannequin, you still must perform this step. If you do not, you will not receive credit. Mrs. Jones, I've already tested the water and it feels okay to me, but I would like for you to test it to make sure that the temperature is good for you. Is that okay? All right, Mrs. Jones. The first thing that I would do is go ahead and place my clean barrier. Again, this is not mandatory, so you do not have to do this. But I just like making sure that I have a clean area to work with or to work on. Okay. Here we go. Okay, so now that you have your table set up, let's go ahead and begin this skill. Mrs. Jones, I'm just going to take your call light and place it right here next to you. I'm going to lower your head of bed. In order to perform this task, you want to make sure that the resident's head of bed is lowered. Mrs. Jones, I'm just going to raise the bed up at a height that's comfortable for me to perform this task, okay? You not only want to think about the resident's safety, but you want to think about your own safety. You don't want to strain your back muscles or your leg muscles. So if you have to raise the bed to a height that's comfortable for you to perform the task, go ahead and do so. All right, Mrs. Jones, I think that's high enough for me. Now, because I'll be turning the resident on her side away from me, I will want to raise the side rail for safety. Mrs. Jones, I'm just going to go ahead and raise your side rail since I'm going to be turning you in the opposite direction of myself. Okay? All right? If you're able to, as I turn you, you can go ahead and hold on to the side rail, okay? All right, Mrs. Jones. Now, before performing the task, you want to make sure that you don or put on a clean pair of gloves. So let's go ahead and put on our gloves. Okay? Have our gloves on. You want to go ahead and make sure you place the linen protector underneath the resident. The reason why we place the linen protector is because we want to make sure that we do not get the resident's sheets wet or dirty, okay? I like to go ahead and open mine so I can be ready, okay? Have it ready to place. Now, for testing, you do not want to overexpose the resident. However, since this is a training video, I will be exposing the resident only in order for you to see how I'm performing the task and how I'm cleaning the resident. Mrs. Jones, I'm going to go ahead and pull down your covers, okay? Okay. With each movement you make, you want to make sure that those movements are slow and gentle. Okay, Mrs. Jones, I'm just going to turn you to the side. Again, if you're able to, you can hold on to the side rail. Okay, on the count of 3, we'll turn. 1, 2, and 3. You can hold on to the side rail. Awesome job. Now that I have the resident turned, I'm going to go ahead and place my linen protector. Now I just want to make sure I push it up underneath her as far as I can, because we don't want to cause any shearing or friction as we pull it through on the other side. Okay, Mrs. Jones, you can go ahead and turn back on your back. And then I'm just going to roll you towards me just a little bit, okay? 1, 2, and 3. We're going to pull this linen protector on through. Okay. There we go. Okay, Mrs. Jones, I'm going to go ahead and raise your gown. Again, during testing, you do not want to overexpose the resident. You only want to expose the area that you will be working with. Again, for this video, I am exposing the resident because I want you to have a good view of how I'm performing this skill. Now, if the resident is able, you can actually have the resident to bend and flex their knees. This will give you a wider area to work with. You want to make sure that you have your supplies close at hand, okay? So with the first washcloth, I'm going to wet it and squeeze it out really good because I don't want water to be dripping everywhere. I'm going to put soap on the washcloth. And I just want to make sure I have the soap on every area of the washcloth. I'm now going to fold my washcloth in 4s. And the reason I do that is because it makes it easier for me to use a clean area of the washcloth with each stroke. I'm going to use the open corners, and as I use them, I'm going to pull them down, exposing a clean area of the washcloth, okay, for each stroke. Now, this is a critical element step, step number 8. You must wash the resident from front to back. If you wash from back to front, or from the anal area up to the stomach, you will not receive credit for this critical element step. You must wash from front to back. So I'm going to start in the middle and wash straight down the middle. I will now turn the washcloth, have a clean area, clean one side of the labia majora, flip over the washcloth with the clean area, clean the other side of the labia majora, flip the washcloth with the clean area. I will now open the labia majora, clean straight down the middle to clean the labia minora. Now I'm going to take my second washcloth, wet it, wring it out. Again, I have this washcloth folded in 4s. I'm going to rinse from front to back, straight down the middle. I'm going to flip the washcloth over to expose a clean area. Again, moving from front to back, cleaning one side of. I'm going to rinse the other side of the labia majora, moving from front to back, opening the labia majora to rinse straight down the middle, the labia minora. Okay? Now that I'm done rinsing the genital area, I'm going to take my towel and I'm going to pat dry, moving from front to back. Okay? So I've used this side of the towel. When I place it down on my table, I'm going to flip it so the dirty side is down and the clean side is facing up, so I can use the same towel on the resident's back side. Now that we've got the front side clean, we want to go ahead and turn the resident. Mrs. Jones, I'm going to go ahead and turn you. Again, on the count of 3. You can hold on to the side rail if you're able to, okay? 1, 2, and 3. Okay. Again, I'm going to apply soap. I'm going to fold the washcloth in 4s. I'm going to wash from front to back. That's from the perineum area up towards the back. You do not want to wash from back to front, okay? You don't want to bring dirty down into clean. So I'm going to wash from front to back, straight up the middle. I'm going to flip my washcloth over to expose a clean area. Clean one side of the butt cheek, flip it over, clean the other side of the butt cheek, and then again, going to clean up the middle, okay? I'm going to place this washcloth on my basin. I'm going to wet my 4th washcloth, bring it out really good. Again, I have it folded in 4s. Now I'm going to rinse straight up the middle, flip it over for a clean area of the washcloth, rinse one buttocks, clean with the clean area. I'm going to rinse the other buttocks, and then flip over, and I'm going to rinse up the middle again. Place that washcloth on my basin. Now, with the clean side of my towel, again, I'm going to pat dry. Okay. Now that I have the resident turned, I'm going to go ahead and roll the linen protector up underneath, okay? Mrs. Jones, you can go ahead and turn back over on your back. I'm going to help the resident turn back over. Okay, Mrs. Jones, I'm just going to turn you towards me a little bit so I can pull the linen protective through, okay? So I'm going to roll the resident just a little bit. Okay, Mrs. Jones. I'm going to dispose of the linen protector in the trash. Now I'm going to gather my supplies and dispose of them appropriately. Mrs. Jones, I'm just going to go ahead and dispose of my supplies, and I'll be right back to get you in a comfortable position, okay? Okay. So I'm going to dispose of the soiled linen in the soiled linen container. I'm going to place the soap in the designated dirty. I'm going to empty the basin. I'm going to rinse the basin. I'm going to empty the rinse into the sink. And now I'm going to dry the basin. And I'm going to place the basin in the designated dirty area. I will now remove my gloves without contaminating myself. Dispose of the gloves in the trash can. I will verbalize, I'm washing my hands. And now I can get back to the resident and get her in a comfortable and safe position. Hi, Mrs. Jones, I'm back. I'm just going to go ahead and get you in a nice, comfortable, and safe position. I'm going to cover you back up with your sheets. I'm going to lower your bed back into the lowest prescribed position. Okay. Here's your call light. If you need me for anything, just push this button here. I'm going to lower your side rails because we only raise them up for safety. Okay. Mrs. Jones, I'm going to open your privacy curtain and your door so you can look out. Okay. Is there anything else you need? All right, Mrs. Jones. Now I will again verbalize, I'm washing my hands, skill complete.